So this is my Appendix G, Individual Evidence Summary Tool. And I'll go through this quickly to just go over the results. I did see that when I was reviewing how to do this, fill out this table, that you should only fill out things that are of A and B quality. So I did not put everything. You'll see some empty spaces because I did not fill those in if they were of low quality. The first article is by Foster from 2016, and it is a systematic review of quantitative literature. And it's the title of it is The Parents, Hospitalized Childs, and Healthcare Providers' Perceptions and Experiences of Family-Centered Care Within a Pediatric Critical Care Setting. It is a synthesis and quantitative research. And they did look at 59 articles. They found that parents and children expressed increased satisfaction with care when they were able to participate in the plan of care and being involved in decision-making in the United States studies. Some of the studies were done outside the U.S. Where there is more of a paternalistic style, and some of those family members didn't really show that it bothered them too much. They weren't that concerned about it because they're very accustomed to the paternalistic style. So this, I'm kind of trying to see what the U.S. studies said. So they said the differences are that in other countries there is a paternalistic style that people are used to and they don't have a problem with it. So the second one I did was one by Goldfarb in 2017, and that was entitled Outcomes of Patient and Family-Centered Care Interventions in the ICU, and that was a systematic review and meta-analysis. There was 46 studies. Let's see, and that showed that patient and family-centered care interventions resulted in decreased ICU stays. Improved 4 outcome measures were improved when family-centered care was utilized, and that was family satisfaction scores, increased achievement of medical treatment goals, increased comprehension for patient and family, and improved mental health sequelae, such as improvements in levels of depression or anxiety or post-traumatic stress disorder, which they have seen in family members and even patients who have been in the ICU for a long time. So, the third study is by Davidson, and this is called the Guidelines for Family-Centered Care in the Neonatal, Pediatric, and Adult ICU. And this study was a pretty big, large study that had included 236 studies, and this was done in 2017. So they found that family presence coupled with an educational program demonstrated improved outcomes. Numerous studies were in support of family presence during resuscitation, with many family members expressing a desire to be present during CPR. Authors recommended that family members should be offered the option of being present during CPR with a staff member assigned to support the family. Maternal and family participants in providing care in the NICU is strongly correlated. So there's a strong correlation between families wanting to be involved in the NICU and wanting to provide care for their infants. They also found that family education programs may reduce family symptoms of depression and anxiety. And some evidence shows that an ICU diary for either the patient or family member can reduce the risk of post-traumatic stress disorder 3 months and 12 months after the patient's death. And this actually is in family members. Some evidence exists for implementation of policies in the ICU to implement family-centered care with increased family satisfaction, and some evidence is for increased family satisfaction with private rooms as opposed to an open ICU, which you can see a lot of places have gone away from the open ICU for infection control reasons, for family satisfaction reasons, and a lot of they are making a lot of the ICU rooms private, at least in the ones I have been in, the children's hospitals And I know that Kaiser has private rooms also. So I think they're just trying to improve family satisfaction, privacy, ability to get sleep. So there's a lot of factors involved with that. And so that's where the shift is, but some of the older hospitals still have the open units. The next article I did was an article by Knapp, and that was a level 2 article, 84 family members in a SICU in a medical center, a teaching university medical center in Florida, level 1 trauma center. And they did, this actually is called the EPICS Family Bundle and its effect on stress and coping of families of critically ill trauma patients. So they actually made up a bundle, a family bundle, and tested that. And this was a quasi-experimental, non-equivalent control pre- and post-test design. I didn't put all the results here because this was a very small sample size, but it does kind of give credence to the need to have these actual plans in place where we can implement like a procedure for family-centered care and kind of bundle it like we do with some of the other things like central lines and urinary tract infections. So this was an experiment which actually it turned out well. It's just that the study itself, the sample was quite small. So I think further studies could be done to see if we could come up with a bundle of some sort to implement family-centered care in the ICUs. So the next one I did was a systematic review of all my highlights. See, I highlight a lot. A systematic review of qualitative research. And this was done by Coombs, and it is from 2017. They did 228 qualitative studies. And so I thought this was interesting because most of them that I looked at were quantitative. And I feel like that when you're talking about family-centered care, you're talking about what subjective things that are kind of sometimes hard to measure quantitatively. So I think this qualitative review is pretty interesting. The title of it is Using Qualitative Research to Inform Development of Professional Guidelines, a case study of the Society of Critical Care Medicine Family-Centered Care Guidelines. So they're saying in this article that they're reviewing qualitative research to help them form guidelines for family-centered care, because like I said, a lot of these things are subjective, and it's how do parents feel, and do they feel comfortable? Are they feeling like they're getting their needs met? Are they feeling like they're getting educated on what's going on? And I say parents because I do work in the PICU, but I do a lot of these studies were not just done in the pediatric intensive care unit. For some of my articles were actually done in adult ICUs or NICUs. So their findings included a key issue raised by patients and families was the importance of clinician support to help them become or maintain a family unit while enduring exposure to the critical care illness. So if they were just starting out and it's their first child, they wanted clinician support to help them become a family unit. So, and if they were an older patient or a parent who had other kids, they wanted to be assured that their family unit will be maintained. So these are very stressful times for families, and these are issues that they want addressed during this time, that they can still, with this critical illness, still maintain their family. And that's a lot. Families also reported conflict between clinicians. If they saw a conflict between clinicians, it reduced their ability to cope with critical illness and delayed psychological healing. Obviously, if you're seeing one attending come on one day and saying one thing and saying, oh no, what the other doctor was doing was wrong, or if the nurse is doing that, of course, that's going to give you distress. It's going to make the families wonder, Do they know what they're doing? What's going on here? What's the plan? So that conflict was a big issue with these family members, that they made them feel less confident in the care. Findings also suggested that families valued peer support interventions in the neonatal ICU. They did some outings. They had families and parents get together. Also, findings highlighted the importance of disrupted sleep and sleep deprivation in the families of critically ill patients, in combination with a desire to always be close to their family member in the ICU. So in the PICU, we find it's very difficult because parents a lot of times don't want to leave their child, and I don't think I would either. Yet in the ICU setting, there's a lot of alarms going off constantly. There's noise, people coming in and out. So being cognizant of, in family-centered care, you're trying to be cognizant of that and reduce the noise level, allow family members to get some rest as much as possible, and things like that to decrease stress, because a lot of times in these families they do end up with a post-traumatic stress disorder sometimes after their child's been in the ICU. The last one is an article by Tomlinson. It was more a discussion paper, and it's a family systems nursing intervention model for pediatric health crises. And this was done on 60 families in a PICU in the Midwest, and they ended up doing. They got data from a pilot study that showed that the family health systems model functioned very well to reduce family stress through directed interventions that promoted family role enhancement in caring for their child. So this was another way of putting everything together and making a model so that we could implement all the family-centered care procedures into the ICU.